Well, palliative care for children is also under the spotlight at the 3rd International Children's Palliative Care Conference being held in Durban. Healthcare practitioners who specialize in care for children with rare and very life-threatening conditions have also come together to share their best practices. Well, among the speakers is 2018 Nobel Peace Prize nominee Dr. Rajagopal, who is also known as the father of palliative care in India, and Sister Frances Dominica, the founder of the world's first children's hospice. Well, to tell us more about the conference, we are joined in the studios by Professor Julia Downing, CEO of the International Children's Palliative Care Network. Very good morning to you. Thank you very much for your time this morning. Essentially, can you give us a bit more information about what the conference is about and what the main focus really is?
Thank you very much. So the conference is about promoting children's palliative care, increasing access to children's palliative care. So we've brought together people from over 45 countries to discuss children's palliative care, to support each other, to learn from each other, so that we can try and increase access to palliative care for children here in South Africa, but around the world.
Of course. And essentially, who is the conference aiming to educate or reach for?
Okay, so we're trying to educate a wide variety of people. So we had some pre-conference workshops, and we had doctors, nurses, clinicians from around Durban joining us for those workshops. So trying to help them to empower them with skills for managing pain and symptoms in children, but also people working around the world to develop children's palliative care services. So quite a wide range of people, and the politicians as well, so trying to advocate for palliative care for children.
Now, take us through then, you've mentioned some of the politicians, take us through government's role and part in the conference.
So governments have been really important, not only just for the conference, but also in the development of palliative care for children here in South Africa. So just last year, a policy was approved for palliative care, and our teams from local palliative care programs, such as Umdiduzi here in Durban and Patch South Africa, the National Network for Children's Palliative Care, are working with the government to try and integrate this policy and to really make sure that this policy impacts the care being provided for children. So the role of government is key in this.
I'm going to bring Dr. Rajagopal into a conversation. A very good morning to you, Doctor. Very honoured to be able to speak to you this morning. Just take us also through the importance of the conference, and also, what sort of sicknesses or treatments are going to be focused on?
Sorry, can you repeat that question? I'm sorry.
A very good morning to you. I'd like to welcome you to the show on Newsroom. Essentially, just take us through the importance of the conference and, what sort of sicknesses and treatments are going to be focused on in the conference.
The world over, millions of children are in serious health-related suffering. It's a paradox that children get less attention medically around the world than adults. The conference is going to concentrate on awareness of that kind of the gaps in care, and also to seek solutions for them.
And how many children have actually been helped? Just take us through, some of these success stories from this conference and spreading the awareness and education.
In terms of numbers, millions are in suffering, and care reaches only a tiny minority. Maybe in most developing countries, proper care reaches only about 1% of the needy. That gap is easy to fill because palliative care is very inexpensive. It may not be glamorous, it may not be high-tech, but it involves more of touch and more of compassion. It is mostly a matter of education, not only of the professionals, but also of the administrators and the man on the street.
Now, of course, just take us through some of the challenges.
Uh, the main challenge is that children do not vote. They don't have an association of ill children who are in suffering. They have no voice. They cannot demand help. And because we love children so much, we protect them often by giving them aggressive treatment even when pointless. Now, this is the sad paradox. In my country, a recent study found that more than 50% of the children dying with cancer had received chemotherapy in the last week of life, which could only worsen the suffering. And that happens because the parents, the family, and the professionals are all so protective that they want to keep on attacking the disease. It is a matter of more education, more awareness.
Definitely. We thank you very much for your time this morning. 2018 Nobel Peace Prize nominee Dr. Rajagopal, who is known as the father of palliative care in India, and Sister Frances Dominica, the founder of the world's first children's hospice. We were also joined in studio by Professor Julia Downing, the CEO of the International Children's Palliative Care Network, upon that conference that is going to be taking place in Durban today for International Children's Day. We thank you very much for your time.